Mr. President, ladies and gentlemen, colleagues from across Canada, it's a tremendous honor to be the recipient of the 2022 Lifetime Achievement Award from the COS. Unfortunately, COVID-19 and my health status with stage 4 mantle cell lymphoma prevent my being in Halifax in person to join you, and I apologize for having to substitute this video. I want to thank Dr. Hall Chu and Brian Balios for suggesting my name, and to thank other colleagues across Canada who wrote letters of support. I thank each of them. My 50-year career in corneal cataract ophthalmology at an academic center has been very rewarding for me. Being part of Sunnybrook's Department of Ophthalmology and Vision Sciences with my outstanding colleagues who are also my caring friends is especially treasured. Sylvia and I feel your ongoing support. The residents and medical students have been a wonderful part of my career also. Their inquisitive minds, probing questions, and their individual talents kept me constantly challenged, both in clinics and in the operating room. However, my reddy brown hair changed to white earlier than I expected, so it wasn't always a glory story. Hospital politics also played a role in the color change. Eye banking, of course, has been a very big part of my life as medical director and co-medical director from 1978 to 2017, 39 years. In accepting this Lifetime Achievement Award, I want to provide a little historical perspective about Canadian eye banking. We owe a great debt to those who guided its founding principles. One being that transplantation tissue would always be provided free for patients, and the second being that we took all donations offered and the eye bank would sort out the ones suitable for transplantation. The remainder were used for research and teaching. It was in 1955 that the COS, the CNIB, and the University of Toronto established the Eye Bank of Canada at U of T. Without the financial and administrative support of the CNIB, it might never have succeeded. Without Mrs. Ann Wolfe and her family's support, I doubt it could have been as successful as it was as soon as it was. Today, tissue and organ donation is almost an accepted concept. Not so, however, in 1955. But as a young, intrepid spirit with a wonderful smile and organizational skills and a deep commitment to human body parts donation, Anne took on the medical establishment and the general public. She was considered a ghoul and disrespectful for the dead, but gradually she turned these attitudes around. She also gave herself totally, 24/7, to receive eyes for many years, with her mother and family members sitting by her home phone waiting for a call while Anne walked her baby or did errands, and before there was any such a thing as a pager. It was an unbelievable commitment. Eye banking could not have succeeded without committed volunteers, most of whom were organized by Ann Wolfe. There were family doctors in many parts of the province who removed eyes day or night. Lions clubs who organized their members for driver relays to bring these eyes to a point near Toronto where Anne met them. Bus lines, planes, and trucking companies brought Anne her eyes. Early Canadian eye banking is truly an inspirational story. Anne was awarded the Order of Canada in 1995 for her exceptional work. My work with Anne at conventions, on radio and TV, all to promote eye donation was wonderful. She was fun, and her medical humor was contagious. Her phone calls around my allocated eyes were amusing sometimes, such as, quote, "These eyes are absolutely gorgeous. He died shoveling snow yesterday afternoon." My wet labs in Sunnybrook, SOARs, preceded surgical simulators and Kensington, starting in the late 1980s with support and permission from the hospital executive. Storz Instruments donated a complete set of cataract and corneal instruments. We had started by removing seeds from green peppers, then moved on to eye bank eyes, which were not suitable for transplantation. We were able to do complete operations, initially intracap, then extracap, then phaco. Orientation to the surgical microscope and suturing practice are vital before resident surgery on patients. I felt that a pair of eyes donated for research and training saved as much sight or more than a pair of transplantable corneas. Lastly, but first really, I want to thank my wife and our sons Ross and John, who shared their time and gave up our time together for my corneal surgical practice in the 1970s, 80s, and early 90s before there was sufficient tissue to be offered for elective bookings. I had to do transplants at literally any hour of the day or night when the operating room became available. Sylvia also worked with me in the office for 30 years. Again, I want to thank the COS for the Lifetime Achievement Award. I also want to thank Dr. Colin Mann, who made a special trip to Sunnybrook Health Sciences Center en route to his vacation to present the award to me personally. And although I cannot be with you in person, I am in Halifax with you in spirit. Thank you for this great honor.